I really want to say to Dr. Lewis, you know, for someone who never had a class with her in my 2 years, you were so supportive of my career as a student. You know, your door was always open, you great mentor. I consider you one of my heroes. I cite your work, appreciate the ways that we've been able to partner. You also even, you know, brought me on to faculty here, and for the past 7 years, I've taught PPD 500 in the spring. And so I appreciate you so much. And, you know, both my wife and I are graduates of this school, and so we both appreciate you and your leadership and your mentorship. So I really wanted to just express that. And I also want to say it was interesting when Dr. Lewis called and said, hey, I'd like you to be a part of this, and she explained who else was going to be here. And I had to ask her, well, are you sure? You got all these folks. I mean, I was trying to think of what I would equate that to, and it'd be kind of like getting a call from Beyonce. You know, and Beyonce saying, hey, I got this little concert thing going on in Coachella, you know, and, you know, I'm doing this thing with you know, bands, and I got, you know, Michelle and Kelly are coming, and, you know, I want you to come and also just be a backup dancer because I think you're going to put me over the top. And so I kind of cracked it, but nevertheless, I'm here. You know, I'm thankful to be here. I have, for the past 14 years, worked for the American Heart Association, and I serve as the Vice President of Government Relations. And one of the things that, you know, listening to Jahmal's presentation and Dr. Van Nuys, I kind of get to talk about some of the practical, you know, some of the policy efforts that we do. A couple of disclaimers. I'm not a medical doctor, so I'm not going to talk about this from that perspective. Also, while I work, you know, federal, state, and local government, I really want to focus on local and state. You know, I also want to say that this is not an exhaustive list of all the things that we do, but some things based on some conversations with Dr. Lewis that I thought you all might be interested in. Also have a lot of information. I'm not going to go through all of it, and especially knowing that, you know, I'm standing between you all and lunch. So I definitely want to be mindful of that, but I think Dr. Lewis was strategic in putting the biggest thing in the room between you all. So I guess I have a little bit of safety, but anyway, let's get started. I pulled this quote from a presentation that was given by the California Endowment. And, you know, we've heard a lot today about the social determinants of health. And you think about this, you know, your zip code and race shouldn't determine how long you live, but they do. I want to say that again. Your zip code and race shouldn't determine how long you live, but they do. And in fact, as we learned from the two presentations before me, you know, health has more to do with race and place than doctor's visits. And so I think that's so important. And I want this opening thought to frame some of what we're going to talk about today. I want to talk a little bit about the American Heart Association's organizational structure. Just want to give you a feel for how we operate. Talk about some of the reasons why we should advocate. And as I look around the room, it's nice to see familiar faces. Some of the work I'm going to talk about, some of you were a part of it and are leaders in your own right and in your own spaces. So it's been great to walk alongside you all and partner. I want to talk a little bit about health equity, some cardiovascular disease risk factors, and then our policy focus, the AHA's to combat CVD. And there'll be a little bit of a rhythm here because I'm going to talk about some risk factors and the ways that we have addressed it, ways that we can address it, and, you know, Dr. Lewis's opening remark about actions that we can take. I think there's an opportunity from here to really walk away and say, wow, we've made progress in this area. Here's where we can go. And then finally, I want to talk about ways that you all can advocate. You know, the American Heart Association, we're a volunteer-driven, volunteer-led organization. So many other organizations like ours, you know, they talk about us as the body parts. So whether it's cancer, lung, whatever it may be, there are great opportunities to be advocates, to be on boards, and to be leaders. And so if you're not connected with one of these types of organizations, would encourage you to do that as well. So a little bit about us. The Heart Association, we're broken up into 7 affiliates or 7 regions. I cover the government relations for the Western region. So if you see here, if you drew a line from Montana down to Arizona, cover everything west, including Alaska and Hawaii. And so it's a very interesting job. You see there, we got some red states, we got some blue states, probably have some purple states. And the way that we address policy and health equity is very different. I started my day talking with some folks in Montana about Medicaid expansion and some work that we're going to be doing in the fall. And very different than the conversation that we might have in California or Alaska. And in some places, we haven't been able to start this conversation in our affiliate, but that's the way that we're broken up. In terms of advocacy and public policy, we have just over 200 staff that do some form of government relations. We have a presence in all 50 states, which really is a strength of ours, so that we're able to mobilize around these issues related to heart disease. And there are a couple areas where we don't have physical staff located where we may contract with staff, but we definitely have a presence in each of our state houses. And then we have a federal shop in DC that works with our folks there in Congress. And then a little bit about us. So our mission is very straightforward: building healthier lives free of cardiovascular disease and stroke. That's what we do. All of the work that we do is focused on that. We have a commitment to public policy. And then you'll see we have a 2020 goal. And it's 2018. We got 2 years left to improve the cardiovascular health of all Americans by 20% while reducing deaths from cardiovascular diseases and stroke by 20%. So this is a big goal. And it's going to take all of us collectively if we're going to get there. Then I want to talk for a quick second about where we advocate. The first three here are pretty straightforward. We're in DC, we're in each of our state houses, and we work at city councils, county boards of supervisors. But there are other places where we can be effective. When we look at health equity, when we look at impacting heart disease, state departments of health, school boards, corporations, universities, and really getting down to the neighborhood level. So many different areas where we can make an impact and make a difference. And I want to talk about why we advocate and why it's so important. And I think of everything I say today, this slide is going to be one of those ones that I hope will stay with you. When you think about the numbers, and these numbers aren't for shock value, they're very real. Over 80 million Americans suffer from cardiovascular disease. 80 million. Nearly 1 million die each year. And over 780,000 Americans will suffer a stroke. Let me provide some context if I'm an advocate, because that's the hat that I wear. I need a volunteer. Somebody want to be a volunteer? Raise your hand. This will be fun, I promise. I need someone to be bold and raise their hand and volunteer. Yes, sir, and your name is?
Bob.
Bob, what's your last name?
Trine. Trine, T-R-I-N-E.
Trine, okay, got it. So Bob is going to be a senator, and where do you live?
Malibu.
So Bob is from Malibu, Senator Trine from Malibu. He's a state senator representing us in Sacramento. How many folks, give or take, do we think Senator Trine represents? Just throw out some numbers. Jahmal, you can't play. Because I think you're going to get us down to the person, and unless someone passed away or was born, you're going to have it. So a state Senate district in California, I'll give you one hint. There are 40 of them. And so it's based on, population. So just somebody throw out some numbers. I mean, you're either going to be right or wrong, and the camera can only see me, so they're not going to know. Yes. I heard 1 million. Anybody else want to throw out a number? 50,000. So we're somewhere between 50,000 and 1 million. Anybody else?
500,000.
I feel like this is like Price is Right. We're like, somebody's going to get it, and you're going to get the washer and dryer or car or whatever. So a Senate district is roughly about 931,000 people. That's who Senator Trine, that's how many folks he represents. Now let's say we're going to his office in Sacramento to talk to him, and we use these stats. So again, he represents 931,000 people. Nearly 1 million die each year. That's almost his total district, you know, if we're using that number for representation. We talk about strokes, his district is gone. So when we go in to talk to him, do you think that's going to matter? And that's going to be important and really set that context? And when you think about a heart attack, you know, someone, you know, dies from heart disease every about 84 seconds. So in the time that I have with you, we're going to lose 15 people. You know, that's important. And you look at the cost, $400 billion in lost productivity and healthcare costs. That's billion with a B. Again, these numbers aren't for shock value. They're very real. And that's why we advocate. I always, you know, when I talk to groups, I like to make it personal. You know, there's a couple of reasons why I chose to work for the Heart Association. I think it started with the training right here in this building. You know, I think we go to Price with core values of service and leadership. And for me, my grandfather was a 2-pack-a-day smoker. I saw him succumb to a tobacco-related disease, and I remember as a 15-year-old saying, you know, if there's anything that I can do to make sure that another young person doesn't experience losing one of their heroes, I want to do it. My grandmother passed away from complications of a stroke, so our mission is extremely important to me. So in addition to looking at it from that lens, I look at this work also from the lens of a father. I have 2 daughters, and I think about, because of the work that we've collectively done, you know, they're never going to be asked smoking or non-smoking at most indoor locations. Think about that. How many of you can remember being asked smoking or non-smoking at a restaurant? Not many. Or how many of you remember smoking on an airplane, where there was, like, you know, this curtain that you went behind and that was a smoking section, you know, and then all of a sudden it wasn't, as if the smoke didn't get to other parts of the plane. Any of you been on a plane recently that had ashtrays? Well, that's good, because that's an old plane and you shouldn't, you know, take the bus or drive where you got to go if that's the case. But, you know, think about that, how our social norms have changed. You know, my kids and kids like them, they're not going to buy unhealthy snacks and soft drinks at school. You know, I mean, I think about my, you know, my younger daughter. I mean, she's eating kale and quinoa. I got to be honest, I didn't know what quinoa was until I started working for the Heart Association. But that's what these kids are getting, you know, because we've gotten, you know, the real unhealthy stuff out of schools. You know, we recently passed legislation that raises the purchase age of tobacco products to 21. You know, we've got a generation of kids that aren't going to be able to buy tobacco products. At least they shouldn't be able to. My daughters are going to be able to stay on my health insurance until they're 26 years old. You know, thanks to gains made by the Affordable Care Act, and gains that we're going to continue to try to protect. And, you know, also thanks to legislation in California and other states, they're going to learn CPR before they graduate from high school. You know, with California, school districts that require health also require kids to learn CPR before they graduate. So every year we're going to have 250,000 lifesavers out in the streets in California. You know, that's big. And so when you think about the impact on heart health, this is why I advocate and why I say all of us should advocate. So Jahmal did an excellent job talking about health equity. So, you know, for the sake of time, I don't want to spend too much time here, but take a look at this graphic. What do you see there? Somebody just shouted out, what do you see? What stands out to you?
Everybody got to fight with equality, and they can't use it. Well, and then in the second picture, everybody got something that they could use that was tailored to.
Absolutely. And so when you think about our health equity work, I mean, that is something that's so important, you know, and we've got to think about that in terms of what we do. You know, I've heard, you know, equity and equality, you know, phrased a lot of different ways, you know, and this is you know, this equity is so important. You know, it's not enough that everyone gets a pair of shoes. You know, everyone needs to have a pair of shoes that fits, you know, something that they can use and something that'll work for them. And one of the things that the American Heart Association, when we look at our approach to health equity, you know, we've really tailored our policy development and advocacy efforts to really think about the unique issues that communities may be dealing with. And so that's something that we really look at with all of our policy approaches across all levels of government. Jahmal had this slide. I absolutely love this slide. You know, we've also, you know, talked about targeted universalism and really making sure, I actually want to read from this particular slide. So we employ a targeted universalism approach to our advocacy work, which addresses the inherent flaw in universal policy where there is an assumed universal norm that can, in fact, exacerbate disparity. And when you look at this, you know, you really see that difference between equity and equality. And if we had expanded that picture out, you know, you also, there's another frame with reality there. And so this is something else that we really look at, is that we want to make sure that we, as we're impacting policy, that we're looking at policy that really, you know, is targeted to specific populations and specific needs. So when we talk about heart disease, there are many modifiable risk factors that lead to heart disease. This isn't a complete list, but these are some that I wanted to talk about. So diet or unhealthy diet, exercise or lack of exercise, smoking, and access to care. You know, when you think about these as it relates to heart disease, these are risk factors that impact you, and that definitely, when you think about equity, you know, there are equity implications there. And then, of course, there are risk factors that you can't control. You know, age, gender, family history of heart disease. Those are things that you can't control. And so what I want to do is talk a little bit about some of the contributors to heart disease and some of the policy approaches that we can take. And again, in the spirit of actions that we can leave from here with, I mean, this is a great example of some of those. So again, I want to read this quote. Without access to healthy foods, a nutritious diet and good health are out of reach. Think about that. Without access, they're out of reach. And without grocery stores and other fresh food retailers, communities are also missing the commercial vitality that makes neighborhoods livable and helps local economies thrive. And so when you think about an unhealthy diet, you know, we can tell people, yeah, you should eat this, or you know, you should have more fruits and vegetables. But if you don't have the basics, you know, if you don't have a grocery store that's available to you, and for that matter, a grocery store that stocks the items that you and your family may need, that conversation of having a healthy diet and eating healthy kind of stops right there. You know, and we don't have to go any further than, you know, going not too far away from this university to see that in real time. So some of the policy responses that the American Heart Association and our partners, you know, when you think about unhealthy diet, promoting nutrition standards in schools, early care and education programs, and out-of-school programs. And we've done a lot of work there at the federal level. Right now, there are a couple things in Sacramento that we're working on, a couple budget appropriations, improving food service guidelines for food. So procurement, if you will, looking at the types of food that, you know, whether it's schools, whether it's government buildings, cities purchase either in their vending machines or that are served in cafeterias and other things. You know, if you think about someone who works for a city, you know, if they're in that building, you know, 7, 8, 9, 10, 15, however many hours, you know, you're kind of limited to what may be available right there on site. And so improving the quality of foods is important. The other thing that we've worked on over the years is sodium reduction initiatives, trans fats. You guys may recall right around 2009, 2010, we passed legislation in Sacramento that got the trans fats out of restaurants and bakeries. And then, of course, we look at added sugars, and I'll talk about that in a second. Menu labeling. This is probably one of my favorite policy areas that we worked on in partnership with a number of other organizations. So you all know that restaurants that have 20 or more locations in California was one of the first, require the calories on the menus and menu boards. And how many of you, because of that, it's impacted the choice that you make or choices that you make? I know for me it definitely has. When we were crafting this legislation, the thing that stuck out to me were the number of calories in a milkshake, you know, which is in some of them over 1,000 calories. You know, and you look at that vis-a-vis what you should get for the day. it's something, and it's every time I go to restaurants that have menu labeling, and I hear people change their choices or get different combinations, I kind of smile and think, wow, I was one of many people that were able to work on what became menu labeling legislation. And then in terms of increasing access to food, we look at farmers markets, which are so important, bringing fresh fruits and vegetables to communities, farm to school programs, the Heart Association. We have a number of community and school garden programs, and teaching young people that their produce doesn't just come from the store, that it comes from the ground. We actually have a program, we had some students that were part of our Teaching Gardens program, went to a local park 2 weeks ago, and they were able to give away the produce that they were able to grow. And what was interesting is that you had young people talking to other young people in the park about the produce that they had done in the program, and they were able to give away plants and seeds. So you had young people that were going to go home, and hopefully, sometime later they'll have their own produce. Sugary drinks. Sugary drinks are the #1 source of added sugar in the American diet, and there's so much work that we're doing around limiting consumption of sugary drinks. When you think about the connection to heart disease, there's a very strong connection. And so soda taxes, we've worked on soda taxes, San Francisco, Oakland, Berkeley, Albany in California, also in our region, Seattle, and there are a couple other places in the country that have done that. And not only are we taxing the drink, but taking those revenues and investing them into communities. So getting more fresh fruits and vegetables, access to fresh, clean, drinkable water and other things. And I think that's so important, because when you think about the equity aspect of it, to tax something and not take those revenues and put them into healthier choices and healthier options would be really unfair. We've also looked at policies around removing sugary drinks as the default option in restaurants, and we've seen industry respond. McDonald's has removed sugary drinks as a default option. Jack in the Box. We've had a number of cities. Long Beach, just a couple months ago, passed the policy. So if you go to a restaurant in Long Beach that requires kids' meals, or that serves kids' meals, water or milk will be the default option. So parents will still have the option to order a sugary drink if they want, but it won't be, do you want a Coke? It will be, will you like water or milk? So they'll have to self-select it, and there's legislation in Sacramento right now that we're working on to bring that policy statewide. There's a quote that really struck me. Of children born after the year 2000, 1 in 3 will develop type 2 diabetes in their lifetime. And when you break that down to African American and Latino children, that number becomes 1 in 2. And I remember when I first read this, my reaction was, whoa. And especially as a parent, I thought, wow, I've got 2 kids, 1 in 2. I've got nieces and nephews, I've got neighbors. This is important. And so when we think about, policies around reducing consumption of sugary drinks, this is very important. And in terms of health equity, an incredibly important issue. Lack of exercise. When we think about contributors to heart disease, this is something else. And making sure that we're working on policies that address sedentary lifestyles and that allow for greater opportunities to be physically active. That's something that's very important. And there are a number of ways that groups like the Heart Association work on this, from securing appropriations to make sure that there's funding, safe routes to school policies when you think about bike lanes and sidewalks, and making sure that people have opportunities to be physically active, complete streets policies, and then increase funding for biking and walking and rolling. How many of you are familiar with Measure M that recently passed here in Los Angeles? Billions of dollars that are going to be available to improve biking and walking and other opportunities. So very important. as it relates to an investment that will impact heart health. Investing in parks, early care and education. You know, when we think about our youngest Californians, setting them up to be as healthy as they possibly can. And then also when you think about lack of exercise, supporting workplace wellness policies are also very important. Tobacco control. You know, when you think about the leading preventable cause of death, it's smoking. You know, if you stop smoking today, you know, your chances of having a heart attack tomorrow are dramatically reduced. And so there are a number of ways that we work on tobacco control, from excuse me, comprehensive clean indoor air policies. You know, being in California, you know, California is viewed as America's non-smoking section, and so we're you know, very privileged here. Increasing tobacco taxes. We just had a big victory in November of 2016, raising California's tobacco tax by $2. Raising the purchasing age to 21. California was one of the first states to do that. Looking at smoke-free multi-unit housing. You know, when you think about the issue of drifting tobacco smoke from one unit to another and its impact on exposure to secondhand smoke and heart disease, extremely important. Funding California's and other states' tobacco prevention and control programs. I don't know if you all have seen, the state just, it was either Tuesday or Wednesday, launched a huge ad campaign around flavored tobacco. Have any of you seen some of those ads? I mean, they're incredible, and that was a direct result of the revenue from the tobacco tax. And I'm looking at Dr. Kuo, good morning, and I think about the revenue that's coming to your team in terms of being able to address tobacco use and exposure in Los Angeles County. And then cessation programs, you know, making sure that those who want to quit have the opportunity to do so, whether it's a quit line, counseling, you know, gums, patches, those types of resources that will really help folks. Talked a little bit about tobacco use in terms of its impact. And if you look at that graphic in terms of what happens when you quit smoking, from the first 20 minutes to a year after, you know, your risk of heart disease is 50% lower. Just huge. I talked a little bit about Prop 56, the $2 tobacco tax increase, and you'll see there, you know, we've got well over $1 billion annually that's going to be invested in various healthcare and tobacco control programs, heart disease research, cancer research, so much that is going to be done. Flavored tobacco, you know, when you think about health equity and the way that the tobacco industry targets communities of color, different communities, targets our young people. I mean, if this isn't a health equity issue that we need to be concerned about, I don't know what is. And so these are some of the ads I mentioned that the state of California has put out. And you look at some of those and how, I like this one in the upper right. The tobacco industry has a kids menu. You know, and you look at how they target our young people and, like I said, communities of color. It's really, I mean, it's just sinful. CPR, I'm going to read this quote real quickly. There's a direct relationship between the median household income and racial composition of a neighborhood and the probability that a person whose heart had stopped would have a bystander perform CPR. You wouldn't think about that as a health equity issue, but when I talked about, you know, our young people getting trained, it's very important that we have more you know, folks who are trained that may be available to perform bystander CPR, because we know that in some communities and some instances that isn't happening right now. And that map just shows all of the states that require CPR for high school graduation. I'm going to go through this. And then in terms of access to care, and I'll get ready to close out, the American Heart Association and others have played a huge role in terms of making sure that more folks have access to care. You know, when we think about health equity and heart disease, that is so important. We started a campaign back in 2007, 2008 called Are You Covered? And we went into the early primary states, Nevada being one of them, And every time a major presidential candidate came to that state, or South Carolina or Iowa or New Hampshire, the early primary ones, we asked the question, if you become president, what are you going to do to make sure that health care is affordable? What are you going to do to make sure that health care is accessible? And what are you going to do to make sure that health care is adequate? And so we were at the front lines of that, and obviously we've seen the impact of the Affordable Care Act and what it means for the heart disease and stroke patient. One final thing I want to do, everyone who has a smartphone, pull it out real quick. And when we talk about ways to advocate, I want to show you guys a real simple way to advocate. So I want you to text WSA Equity to 46839. And so this is one of the ways when we're trying to influence elected officials. We'll get messages in via text. And so I see Josh has taken action. And this is real cool. So the pin drop, this is real time, this is live. So as you guys do this, your names will show up. So you see that, these are real actions. And had this been an issue that we were taking action on, by doing this, your message would have gone to, Congresswoman Lewis or Senator Miller or whoever. And so that's something, I love to do that when we're in group presentations and conferences and things, because it allows a bunch of people to take action and really see the results of their action. So I see Ashley, Jahmal, Lily, others in there. And so just take action as you can. And again, that opening thought of actions that we can take. I just want to leave you guys with this final thought. If you want to go fast, go alone. But if you want to go far, go together. And I think if we're going to impact cardiovascular disease and stroke, it's going to take all of us together addressing health equity and so many other things. So again, Dr. Lewis, thank you so much for the opportunity to share. And I guess we'll take direction from you. Thank you.